Hi, I'm Dr. Priya Matthew from MVP Family Dental, and I will be speaking to you about dental implants today. Dental implants are a way of replacing your teeth. They are like an artificial tooth root. They're made out of titanium, and they can help you replace your teeth almost without anybody having to know. So a dentist would recommend dental implants if you are missing one or more teeth. That's when we would recommend them. The advantages of a dental implant are that you don't have to take it out and in. Once it's in and the crown has been restored, you do not have to take it out. You just brush it like you normally would. You floss it like you normally would. It doesn't have to come out at nighttime. It's comfortable. You don't feel it. It's pretty much painless. There are a lot of advantages to a dental implant. The process you would go through if you decide to get dental implants is, first, you would come in for a consult. We would take a look at the area that you are interested in getting an implant in. We would take a couple of scans. One would be an intraoral scan, which is like a digital impression, so you don't have to get all the goop and all that messy stuff for an impression. We just literally scan you intraorally with a scanner. And then we take a CT scan that we have in the office, which will give us a 3D x-ray, if you will, of your jaw, and we can see if there's enough, everything is in a good condition to get a dental implant. Yeah, so then once we confirm that you are a good candidate for a dental implant, that's when I do the planning. I get a stent made, which is like a guide for where the implant exactly is going to go. You make your appointment, you come in, we put the implant right in there. It takes about half an hour max. You're numb for the procedure, you don't feel anything. The next day, usually patients are totally fine. They don't really even have to take a Motrin or Tylenol. And then we just wait. We wait about 3 months for the implant to completely heal and adhere to your bone, basically. And then you come back in 3 months, I give it a check, make sure it's stable. If everything looks good, then we can go on to the crown, which just all I do is put a little scan body in there, it's called, which is a little piece that we just screw into the implant. And then we take a scan of that, a digital scan. Then the lab makes the crown, and you come back in a few weeks and you get your final crown. Sometimes people need a tooth removed and then the implant placed. So sometimes we can actually remove the tooth and put the implant in at the same visit. It all depends on the situation. If the tooth is really infected, then we might want to take out the tooth, let it heal, get rid of the infection in that area, and then later, at a later date, place the implant. Bone grafting is required when there's not enough bone in the area of where we want to place the implant. So basically, if the tooth has been missing for a long period of time, maybe more than 5 years, the bone will shrink down and it becomes thinner. So in that case, we might need a bone graft to have enough bone for the implant to adhere to. When choosing new artificial teeth, there are different options. One would be the implants, like we're talking about. Those are fixed options, so they don't come out of your mouth. Then we also have partials, which are partial dentures that can come out and in. Those do come out at night, and they don't feel as natural as your normal dentition, whereas implants do feel just as natural as your normal teeth do. So I would say that implants are the best option for replacement of your teeth because they look the most natural, they feel the most natural, and they're just the most comfortable. Implants should last you 10 years or more, as long as you are keeping up with your hygiene appointments in the office and also at home care, like you're brushing your teeth, you're flossing regularly. It's kind of like a car. You have to keep your maintenance on the car for the car to keep running properly, so it's similar to that. Dental implants can cost about $2,500 to place the implant, and then $2,500 for the crown. This can be broken up into different parts. We will work with you to make sure that it is affordable for you. And we also have financing options. One company we use is Cherry Financing. You do apply, you can apply from your own phone in the office. You get approved for however much the amount is, and then you can get started as soon as possible. Cherry Financing has 12 months interest-free options. If you are approved, you can get 12 months financing with no interest. You can schedule an appointment for a dental implant or any other dental needs at MVP Family Dental. You can call us at 215-887-7171 or visit our website at www.mvpfd.com.